Good afternoon. Welcome to this lecture. Dr. Akudu Watune is my name. I'm a lecturer and consultant family physician in the Department of Community Health and Primary Care, College of Medicine, University of Lagos. Today we'll be talking about epidemiology of newborn infections. So at the end of today, we should be able to describe the burden and transmission of newborn infections, and then we should be able to discuss the risk factors that predispose newborn to infections. Newborn infections refers to invasion and uncontrollable growth of microorganisms in the newborn babies. Now, epidemiology refers to the occurrence and distribution of diseases in different populations. Now, epidemiology refers to the disease occurrence in terms of what is the problem. In this case, we're talking about newborn infections. Why is the problem occurring? The problem is occurring because there are infections from the transmission from mother to child, either from the placenta or through the birth canal or from healthcare facilities. And how is it? How does it occur? It occurs through transmission of bacteria or organisms from a source to a newborn. So information from the epidemiological process will help planning strategies for interventions to reduce the burden of the problems. What's the role of epidemiology in neonatal infections? One, it allows us to estimate the size of the problem, the burden of the problem, the proportion of neonates that is infected. We know that about 26% of newborn is affected by neonatal infections, commonly due to sepsis. Sepsis takes about 16%, while tetanus takes about 2.5%, and then we have respiratory infections taking about 7.2%. So all these account for a large chunk of infections in the newborn. Now, there is need to also establish a baseline proportion of infection, so that when there's an increase or outbreak, then we'll be able to detect on time. Now, there is need to assess risks in newborn babies. There are two types of risk. There are newborn risk and there are healthcare facility-related risk. The newborn risk includes low socioeconomic status of the parents or the child, low birth weight, prematurity, concomitant infections in newborn, like a newborn that has diabetes in the mother. Usually they have infections at birth, or they are born with a large weight, more than 4 kg. So these problems are newborn-related problems. We also have health-care-related health facility-related problems, which include maybe the environment where the baby is born, maybe there's poor hygiene there, the healthcare, the hygiene of the healthcare, maybe there is understaffing or overcrowding of the newborn babies in the facility. These are risk factors that also predispose these children or these neonates to neonatal infections. Now, interventions are very important to be done in order to reduce this burden of infections. So, as I said before, in epidemiology, you talk about questions, we ask questions and they provide answers to these questions, and these answers usually generate more questions. For example, you want to know what is the problem. In this case, the problem is the neonatal infections. You want to ask what is the problem. The question is what is the problem. The problem is neonatal infections. Problem with neonatal infections. Now, next is to why is the problem occurring? The problem is occurring because the mothers have infections that are transmitted from the placenta or vagina or maybe healthcare-related facilities. And how is the infection transmitted? Usually through maybe poor hygiene, or an adult that has some infections and then spreads it to the child at home, which is usually the source of infections in the newborn. Usually the people the caregivers around the child are usually the first source of infections for the child. And we also need to find out what action is to be taken. Now, what you need to do is to find out the problem and then plan strategies to prevent, to reduce the infections. The community interventions is very important. You have to mobilize for the community. You have to also create awareness among them. Teach them how to identify these problems. These are actions that need to be taken in order to reduce the burden. Now, the size or the burden of the problem is usually very high. As I said before, Nigeria accounts for second most. We have the highest number after India, the highest number of infants that have neonatal infections. Now, the deaths that occur from neonatal infections is also very large in Nigeria. The National Demographic Health Survey in 2018 revealed 38 per thousand deaths of neonates in Nigeria, and most of this occurred from infections such as neonatal infections, sepsis, AR infections, respiratory infections, and tetanus. Sepsis account for about 16.2%, which is the largest among the infectious agents. So the data there is showing a comparative distribution, developing countries and the global world generally. And there we'll find out that globally, we have more infections from neonatal sepsis. Neonatal sepsis in Nigeria account for about 16.2. Globally, it's about 15, which is lower in other countries. Also, tetanus is about 2.5 to 2.6 in Nigeria. Globally, it's lower, about 2%. Also, preterm babies, preterm problems. It's also it's a higher level of problem in Nigeria compared to globally. Globally, it's about 29%. In Nigeria, it's about 21%, which is higher. However, respiratory infections are higher in developed countries compared to our country. They account for about 10% in developed countries, while Nigeria has about 7.2, which is lower. Okay, so this slide talks about the how the transmission process occurs. The how, that is the process of transmission. So here you see that according to that graph, the diagram there, the reservoir is maybe household utensils, tap water, the water we drink in at home or used for bathing the child, or health care facility equipment. When these are contaminated, then they serve as routes of transmission. Also, adults around the child, like an adult that's coughing or an adult that has diarrhea, if you don't take a proper care of those contaminated environments, they will go on and infect the child. And infections is a common route of infection for the child. A caregiver needs to wash hands thoroughly, carefully, frequently before touching. Even healthcare workers, between a child and the other, you have to wash your hands clean very well, so that, and then provide a barrier touch, so that the other children are not infected. So upon entry of those infections to the newborn, they gain entry into the airway, that's the lungs, or the oral cavity, mouth, and then through the anus. So, and then the child becomes susceptible to the infections. So there are some risk factors. You can classify risk factors into two. We have the newborn related risk factors. This includes prematurity, low birth weight, premature rupture of the membranes. Now, low birth weight is a common problem. Normal birth weight should be around, each child should be born with take 2.5, minimum of 2.5 kg. So a child that is born less than that is called a low birth weight. And this also predisposes to having some risks for infections. Also, the large babies, also especially from a mother who has diabetes, mothers who have diabetes also have they deliver babies that are very light, more than 4 kg. They also have risk for infection because and then have birth trauma because of the large body size. They have birth trauma, and they also are prone to infections because of the diabetes from the mother. Rupture of the membranes. Now, the bag where the baby is kept, it's called amnion. At times, it ruptures before labor starts, and once this happens, it means the child's internal cavity is exposed to the exterior. So, health workers doing vaginal examinations put the child at risk of infection because the barrier is already broken. So, this premature rupture of membranes usually put the children, the neonates, at risk for infections. Healthcare acquired infections are very common, maybe Staphylococcus aureus, hand infections, tetanus. These are things that also are very important in newborn infections. So identification of this infection is very important. Early identification is the key to control of these infections. Once the health worker fails to identify on time, then the chances is that the baby gets worse, and then the problem is worse than ever. Poor cord care also is a big problem in the newborn, because the cord must be taken care of adequately and properly. Cleaning it, making sure it's not dirty, and then there is no root of infection there. So, the cause of infections, as I said, this answers the why questions. The why include one, that the infection can pass through of the mother to the baby through the placenta, example HIV or hepatitis. Then the other route of transmission is the birth canal. The birth canal may have some candida infections in the mother or some herpes simplex in the mother. So as the child is being born through the vagina, the child also gets infected with these infections in the birth canal. The other form of why they come down with infection is poor environmental hygiene, and then the facility that is also in poor condition. So when the facility is poor, the environment is poor, then the risk of infections or dirtiness is obvious. So as I said before, newborn the risk can be classified into a newborn risk and healthcare giver related risk. The newborn risk include low birth weight. When the child is less than 2.5, is risk of having newborn infections. When there is prematurity, when the child is when it's delivered before the 7 completed weeks, this also may give rise to infections. The weakened immune system. The soldiers of the body, they are called lymphocytes. When they are not properly formed in a newborn, they may also predispose the child to having recurrent infections. Comorbidity, that is occurrence of different disease entities in the same child. Maybe, for example, a child that is born to a diabetic mother, the child may end up also having diabetes, or the child that has some abnormal formation, maybe 2 heads or like that, any abnormal formation of the body, also present to infections. So these are things that usually makes them more susceptible to infections. Now, so for the care-related risk factors, this involves the caregiver. It needs to be clean. Whoever is taking care of the newborn, you have to maintain barrier nursing, wear gloves, wash very well, and wash between a child and the other, and wear gloves between the child. You have to dispose the glove that you use for one child, do not use for the other child. Now, healthcare facility related infections account for about 20 times the risk of infections in the developing countries compared to developed countries. Now, medical procedures are also high risk for introducing infections to the children. The central line, the intravenous cannula that you're using, you have to be sure that it's intact, it's sealed, so that it doesn't introduce infections. The use of antibiotics, abuse of antibiotics also reduces the immune system of the children, of the neonates. So you have to make sure you don't use antibiotics unless it is indicated. For example, a child that has virus infection, you don't need antibiotics. So when you give antibiotics, it also weakens the immune system of the newborn. So you don't abuse this. Now, overcrowding is a problem because ventilation is compromised. Once there is overcrowding of newborn babies where they are kept either in the health facility or at home or in the hospital, once there is overcrowding, the ventilation is poor. Also, understaffing is a problem. When a caregiver is nursing like maybe 20 newborns at a time, then the risk of transmitting infection from one child to another is it can occur. So that means you have to increase the staffing. Let a child, maybe 1 or 2 children be nursed by a staff. The length of stay also matters. When children spend more than necessary duration of days or weeks in the hospital, it makes them prone to acquired infections called nosocomial infections. So for us to prevent or reduce the burden of infections, then there has to be standard precautions or strategies to reduce transmission of infections in neonates. The first is to ensure that you maintain standard or universal procedures, precautions, washing hands between one child and the other, using barrier nursing, wearing gloves between one child and the other, ensure that you don't crowd children together in the place, and make sure the caregiver is well kept. His personal hygiene is optimal. Immunizations is very key too in preferring strategies to control. Hepatitis B vaccination is important because once the children are vaccinated, against such diseases, then it prevents them from having such problems. Cleaning is very important. You have to clean the environment. You have to sterilize the equipment you are using. Maybe you are using some scissors or scalpels or blades or any equipment that you use for the children. You have to make sure they are all sterilized. Sterilization is heating to high temperature to kill bacteria and spores. Disinfection is very important. You have to make sure you clean all equipment with chlorine or peroxidine to make sure that all germs are killed. All these are designed to prevent the occurrence of infections, and these are the things that will form the basis for subsequent lectures in our lectures to come. So, as a form of conclusion, we have talked about the burden of neonatal infections. We talked about, we said that about 26% of newborn babies have sepsis. Out of 26%, about 16% is accounted for by other infections, commonly due to sepsis. And then we have 16.1 for sepsis, we have 7.5 for respiratory infections, and we have about 2.5 for tetanus. However, the large burden is from sepsis, accounting for about 16% of 26% of neonatal infections. Thank you very much.